Yeah.
Okay, I'm with Roger Libby, and we are talking about sex addiction. So tell us more about your opinion about sex addiction.
Well, it's not just my opinion. I think we have to look at the data. The research does not show that sex addiction exists as a concept, or that hypersexuality exists, because we've never had any, norms for this. And so the Diagnostic and Statistical Manual, the DSM, that therapists use to diagnose problems, soundly rejected both sex addiction and hypersexuality in the most recent edition. And also the ASEC, the American Association of Sex Educators, Counselors, and Therapists, recently did a position statement against sex addiction, which has caused a lot of conflict with these sex addiction groups. And so it's just heating up because it's about money. The sex addiction people, especially the inpatient clinics that charge $30,000, $40,000 a month to supposedly treat somebody for something that doesn't exist, they're really upset because they're starting to lose their income. They're starting to lose the way to make the money that they've had for 25, 30 years. Mm-hmm. And so they're on the run, and they're on the run because people like myself and David Lay and Marty Klein and a few others have really, and Nicole Prouse, have all been doing research and writing about this and speaking about it and speaking out about it so that people don't feel ashamed of their sexuality, because the whole 12-step program doesn't work. I don't think it works for alcohol. It certainly doesn't work for sex because it doesn't get an internal locus of control. It doesn't help you take control of yourself. All it does is you rely on external, reinforcement, like going to a sexaholic group or something, which is where people meet to hook up, really. Mm-hmm. And so it's not a viable concept. I think it's harmful, it's destructive, and of course a lot of the people in this area of sex addiction do have a rigid religious background. Not all of them, but I would say a lot of them do.
Yeah. So, in my work, a lot of people just throw this term around, sex addict. Oh, I think I'm a sex addict. I think my husband is a sex addict. So how do we begin to dispel this myth that there's no such thing called sex addiction? Like what term are we going to be able to introduce? We don't use the word sex addict.
That's a good question. I mean, some people talk about being out of control and how that could be a concept. I just talk about being out of balance, because I think people who, for example, if you get to work because you're masturbating to porn all the time, that's out of balance. Now, it doesn't shouldn't never masturbate or look at porn, but you've got to put it in a perspective, in a sense of balance. So sex is part of your life. It doesn't consume every part of your life, though. Yeah. You see what I'm saying?
Yes. So would the term like sexual compulsivity be a much better term rather than sex addict?
Well, positivity, yes, being because the problem, the sex negative.
Compulsive, I mean.
Yeah, because the sex addiction approach is sex negative. It's not affirming sexuality or love. I mean, Robert Weiss and Stephanie Carnes and all these people will argue otherwise, but that's because their bread is being buttered with it.
Okay, so for people who think that they are sex addicts, or think that they're sexually compulsive, what can they do about it? You say they're out of balance. What can these people do?
I think they need to see a good sex therapist, a person like myself who does cognitive behavioral therapy, to try to get them in balance with their thoughts so that their feelings and behavior will follow. And I think if you don't deal with the thoughts, they're going to believe they're addicted. Their partners are going to call them addicted because they think they want too much sex. I mean, it's like throwing a barb at somebody else and saying, cut it out. You're having too much sex. And, you're probably having more sex than the person who's calling you that. And it's just a lot of moralistic crap is all it is. And it's not scientifically justified. That's the important thing. It's a creation of Carnes and the media, really. The media ratified this over the years. And now the media are starting to say, well, maybe we were wrong, and they're starting to take a second look. But there's today still a lot of controversy about this. I mean, I'm a member of a secret group on Facebook dealing with this, and there are 100 of us, 100 right now. And it's the only way we can coordinate and actually a defense as well as an offense, because the best defense is a good offense. And I think the offense is to offer something positive about sex, like I do with orgasm or with my work, my writing, and my speaking. And I used to have a radio show in Atlanta. It was called the Pleasure Dome, and it was the most popular show in Atlanta for 3 years. And, you know, I also created petting zoo parties when I was in Atlanta. And that was where, because I talked about the pheromone attraction and how, you know, our sexual chemistry is based largely on smell and hair in the body. And so I got a lot of questions about that. And so what I did was I decided to have petting zoo parties at nightclubs, and I would go dressed in a safari outfit with a whip as a zookeeper, and everybody else came dressed as their favorite party animal, like tigresses and everything, and they were all perfect strangers. Most of them were single, not all of them, and they made out and petted with each other and sniffed each other, and the ones with the pheromone attraction left together. It worked.
That's great.
Yeah.
So we call these people furries, right?
Pheromones.
Yeah.
What?
Okay.
Yeah, pheromones is PHEROMONS.
Yeah, sure.
I mean, that's really the essence of sexual chemistry.
Okay, so just to repeat that, we believe that it's very important to be sex positive, to not just throw terms like sex addiction loosely. And in fact, there's a lot of studies and controversial around whether this term even exists and whether it's even valid. And the media are also even questioning this. And so those people who feel that they're sexually compulsive can seek support from sex positive sex educators and sexologists like myself, and sex therapists like Roger Libby here, and we will be able to work with people who feel that they want to really get in touch with their sexuality in positive ways. So that's my little summary here.
Yes, that's a good summary. That's exactly right.
Anything else you'd like to add?
Well, I think we all have roles to play. The sex researcher, the sex therapist, the sex educator, the coach. I mean, these are all roles that I think the important thing is that we operate within our realm of confidence in terms of what we're prepared to do. In other words, you know, I don't think that some marriage counselors are really prepared to deal with sexual issues, and yet they do. And what they often do is just convey their own biases, and then I end up seeing the same couple later because they didn't get any help, and I have to undo a lot of the advice they got.
Yes. So I completely agree. I have the same problem. I have clients who actually approach their counselor or marriage therapist with or psychologists with problems relating with their sex life instead of dealing with that problem, they start going into like relationship and communication and totally avoiding the issue of sex. So after 1 year of having that kind of problem, or maybe years of having this problem, then never really tackling that issue, because really that helping professional was not really comfortable tackling the topic of sex in the first place, and also not have had the training in order to really support them in exactly what they need. And so this results in a less a so-called waste of time, money, energy, and faith in the relationship, and whether they're even cut out to work things out. And so it causes a lot of stress, and it's really so painful for me, and I'm sure for you, Roger, too, to have clients come in where it feels like it's just, you are right at the end of the relationship, and sometimes it can be a point of too little, too late.
Yeah, and it's better when people have problems to seek help earlier rather than later. And sometimes one of the two people in a couple is dragging their feet, and it's often the male, you know, because even if it's his problem primarily, the female will approach me, and then he'll resist coming in because he thinks he should be able to deal with a sexual issue on his own. Well, obviously, if he was going to, he would have. And that's why we exist, right?
Yeah. Okay, so we're going to wrap up this, and we are making a call out for those people out there who feel that they need support. Please be sure to do the research into the credentials of your therapist, a counselor, or a sexologist, and really make sure that they are actually approaching sex from a sex positive point of view, that these people actually do know what they're talking about. They do like sex and they love sex. And it's very important to get that kind of support from people who know what they're talking about, rather than people who hate sex are actually going to tell you that there's something wrong with you, and then actually not supporting you in your growth. And that's something obviously Roger and I are very passionate about.
Right, and I also help people online when they can't find a therapist near where they live. I help them online, you know, with Skype or one of the other programs.
Great. So thanks for this, and we'll keep in touch.
Well, thank you, Martha. Yes, we will.
Thank you.